Hello, everyone, and welcome to this presentation of health literacy and introduction and tools tips. My name is Michael Villaire. I am President and CEO of the Institute for Healthcare Advancement. Without any further ado, let's get into the presentation. So let's take a look at some of the things that you're going to learn. We're going to give a brief overview of health literacy with some definitions, components, examples, talk about how often health literacy really occurs and what the cost is for that. We'll provide you with some high-level tactics for clear, accessible, and effective health communication. Talk a little bit about rewrite and design, a couple before and after examples, and then talk about some tools and training resources, including the Health Literacy Specialist Certificate. Okay. So first of all, to get into some definitions, literacy, a lot of people say, well, what's the difference between health literacy and literacy? Well, literacy is really your ability to read and write. It's using printed and written information to function in society, to achieve one's goals, and to develop one's knowledge and potential. Health literacy, there's a couple of definitions of health literacy. Here's kind of a higher level one. Health literacy occurs when the demands and the expectations of our health system equal the skills of the public. That's the level set. That's the health equity situation. That's really where health literacy occurs. Healthy People 2030 has been providing definitions of health literacy since it began. The latest one from Health Literacy, or from Healthy People 2030, provides definitions for personal health literacy as well as organizational health literacy, and you can see those here. Personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Organizational health literacy, on our side, is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So you can see, rightly so, that the onus for encouraging and providing good health literacy lies with us, the healthcare system. Health literacy components includes reading and writing, the ability for individuals to read and write. Also in that two-way communication, it's the listening and verbal communication skills with the customer and patient and us, the providers. Another very important and sometimes overlooked component of health literacy is numeracy, which is the ability for individuals to make simple calculations. This can be something as what we would consider as simple as take one tablet 3 times a day. We know that that should be spaced out. So when would you take that particular tablet? That's going to involve a little bit of numerical calculation. And so that puts a burden on the individual that they may not be able to adequately handle. And then there's also interpreting and evaluating risk, things like percentages. You have an 80% chance of this happening. The efficacy or the ability of this medical intervention is 10%. These are all very abstract concepts and numbers, and sometimes they're very difficult for the individual to understand. Here's another example. Provider or somebody says to a person, here are 2 medications that you can use. One is very inexpensive. It costs $1 a pill. This other one's very expensive. It costs $50 a pill, and you need to take this twice a day for the rest of your life. First pill, the $1 a pill, has a 1% chance of helping you out. The $50 a day pill is twice as good. It has a 2% chance of helping you out. Which one do you want? Well, that's a very difficult decision. And if you really drill down to that, if you have some skills in numeracy and in risk and percentages, you understand that the difference between 1% and 2% is really negligible. And so does it really merit the cost of $50 a day or $50 per pill for that individual? So this notion of evaluating risk and understanding what that really means is a very abstract and difficult concept. A lot of people have difficulty with that, and we need to be very aware of that as the representatives of the healthcare system. And then health literacy is also really about self-efficacy. So if you are newly diagnosed with diabetes and your provider gives you information on how to take care of yourself in terms of diet, in terms of measuring your hemoglobin A1C, and all of the things that you need to do and what some of the risk factors are for that, We, as the healthcare system, need to be able to do that in a way that that person really understands so that they can reach that stage of self-efficacy and really be able to take care of themselves. Some other considerations include our culture and belief systems. My beliefs and how I see the world are not necessarily the same way as you do. And so when we bring that into the equation, this can become very problematic. One of the more glaring and striking examples of this is featured in a book called The Spirit Catches You and You Fall Down, written by Ann Fadiman. If you've ever read that book, you understand that there was a Hmong, H-M-O-N-G, a Hmong family in Northern California, sometime I believe in the 1990s, where there was just a clash between the healthcare system, which wanted to use a Western medicine-based approach to the daughter, the young toddler daughter who was very sick, and the belief system of the family, who was very religious and believed that the cause of the daughter's illness was spiritually based. And these two cultures, these two systems clashed and butted heads. And unfortunately, this did not work out well for the daughter. And so understanding and respecting culture and others' belief systems is a very important component for us as the representatives of the healthcare system. Individuals' past experiences with the healthcare system. This speaks to the issue of trust. And really, if to the extent that if we as the healthcare system are providing information for individuals and things that we want them to do, this could be colored or this could be tainted by their past experiences with the healthcare system. So we need to be aware of that. Also, this mismatch between what we are asking individuals to do and frankly, what they're able to do. I can tell somebody, here's what you need to do. You need to lose 40 pounds and start doing this and watch your diet and only eat, a very vegetable forward kind of diet. If I don't understand how to do that and I don't have access to vegetables because of where I live, that's an unrealistic demand on my part. And so therefore that's just not ever going to happen. Also, when we're providing education materials, there's a lot in the literature talking about the mismatch of the reading level of the reading ability of individuals versus the grade reading level at which those materials are written. Most people in the United States, most adults are probably reading at or below an 8th grade level. Most materials that are written, health education materials, are written somewhere between the 9th and 12th grade level or higher. And so you can see that there's a significant mismatch there. Health literacy has a strong relation to health disparities in terms of a lot of times the social determinants of health. Where are you born? What do you have access to in terms of clean water and education and all of those different pieces? And how can you access the healthcare system and achieve a state of health literacy so that you can thrive? Also, health literacy has a very strong relation to safety and quality. If individuals don't understand what we're asking them to do, they can make some very dangerous decisions based upon the information that they have and how they understand the information that we have given them. So here's this gentleman whose doctor told him only have 1 glass of alcohol a day. I can live with that. Unfortunately, this glass is probably a little bit more than what the provider had envisioned. But this was an assumption made on the part of the provider that the concept of 1 glass was a shared concept, that was a 1 ounce or 1.5 ounce of spirits or a 12-ounce beer or a 4-ounce glass of wine. This individual had a different idea of what a glass meant. And so when we make these assumptions as part of the healthcare system, we can see that we can we can have that mismatch between understanding of what we as the healthcare system understands as opposed to what the individual does. So here's a few examples. Mr. G, 45, a native Spanish language speaker, has a job health screening. He's told his blood pressure is high and he can't work until it's controlled. He's given a beta blocker, a diuretic, and written instructions to take each, quote, once a day. 1 week later, he presents at the emergency department. His blood pressure is very low and he's dizzy. The doctors can't figure out what's going on. A Spanish speaker in the emergency department asks him how many pills he took each day. 22, says Mr. G. In Spanish, the word once means 11. So here's an individual who could not read English. Spanish is his native language. The only word that he saw on there that looked familiar to him was ONCE, which he read very correctly in his language as once. So he was taking 11 pills per day. So the question then becomes, can limited health literacy kill you? Well, in this instance, it very nearly did. So another example, at a teaching hospital, an intern writes in a patient's problems section of the medical chart, speaks no English. The attending physician writes a note back in response, your problem, not his. Just because somebody does not speak our language does not mean that they have, that is their problem. That is a barrier. That is a challenge. That is something that we, as the healthcare system, have an obligation to identify and remove that barrier. There are language access resources. There are interpreters. There are a number of different ways in which this challenge, this barrier can be addressed, but it is not a problem of the patient. We are the healthcare system. We are the ones with the knowledge. We are the ones really holding all of the power. And so it is our obligation, legally, morally, ethically, to take care of these kinds of situations in a compassionate fashion. So let's take a look at some health literacy statistics. Literacy and health literacy statistics, there's really two major studies that have been done in the United States. The first one, the NALS, the National Adult Literacy Survey, kind of provided us with a baseline. And then the one that we're going to be taking a look at, the NAL, the National Assessment of Adult Literacy, had an added health literacy module. Unfortunately, there are no further NAL studies planned here in the United States. But if you do want to get a sense of where the literacy levels are for any country, including the United States, the PIAC, the Program for the International Assessment of Adult Competencies, and you can see the URL there, you can get some data on current health literacy statistics there. So let's take a look, first of all, at literacy levels from NAL. 4 different categories. You can read them there below: basic, basic, intermediate, and proficient. And then the literacy findings, this is the percent of US adult populations who scored in the bottom 2 categories, which are the below basic and basic. In prose literacy, which is just your ability to read and write, or I'm sorry, just to read paragraphs, just copy on a page. The percent of US adults who fell into the bottom 2 categories, 44%, almost half of the adult population. Document literacy, which is your ability to look at a form or a chart or a table and find a specific piece of data in that chart, 34% fell into the bottom 2 categories, which is about a little more than 1 in 3. And then quantitative literacy, or numeracy, as we talked about a little earlier, this ability to kind of deal with numbers and understand numbers, make calculations, understand risk and percentages and those sorts of things. 55%, more than half of the US adult population, fell into the bottom 2 categories, according to the NAL. Now, there was, as we said, the health literacy component and some questions that were asked there. And these results are not encouraging. 36%, more than 1 in 3 US adults have limited, what we would call limited health literacy skills, essentially that they fall into those bottom 2 categories, and you can see the breakout there. Only 12%, a little slightly better than 1 in 10, are considered proficient. And really, if you think about the healthcare system, this is not an easy system for anybody to navigate. So I would certainly make the argument that one would need to be considered proficient in health literacy to be able to really completely and effectively navigate the healthcare system. And as we can see from the statistic, only a little better than 1 in 10 adults have that level. And then about half had intermediate health literacy levels. So here's a few more numbers. If we're just trying to paint a picture of those who have limited health literacy skills, we can see, and again, before I jump into these numbers, it's important for us to understand when we look at these statistics that this does not mean if you fall into one of these groups that you automatically have poor health literacy. What we are saying is that some of these individuals in these particular categories tend to have lower health literacy, or those groups as a group tend to have a higher percentage of individuals with limited health literacy. It's a very important distinction for us to keep in mind. So if we look at, first of all, the group of those who are 65 years of age and older, almost 60% of those individuals fall into those bottom two categories of basic and below basic levels of health literacy. Those individuals who get health insurance from an employer tend, as a group, to have higher levels of health literacy. Those on Medicare or Medicaid or have no insurance tend, as a group, to have lower levels of health literacy. Hispanics, who represent about 19% of the adult population, as a group, are about 35% of those who are in the bottom level, the below basic health literacy category. And those who are at or below the poverty level, which statistically is about 12% of the adult population, they represent about 43% of those in the below basic health literacy category. About 3 in 10 white individuals have basic or below basic health literacy. So this is not just a minority issue. This really goes all the way across the board and really affects everyone. And then another interesting one is those who were asked, how is your health? And they self-reported that they had poor health. 75% of those fall in the below basic health literacy category. And those statistics are as a result of come from the Null 2003 study. So why does health literacy matter? Well, there's a lot of reasons why. And I mean, here are some of the ones. Those with limited health literacy skills tend to report poor overall health. They have a poorer ability to manage their chronic diseases. And much of this comes from the fact that we, in our education and our management of those individuals, don't do a great job of making sure that they understand what are the risks, what are the tasks you need to do, what lifestyle changes do you need to make to manage that chronic disease. And we're talking about diabetes, high blood pressure, asthma, any of these chronic diseases. Those with limited literacy, this should say health literacy skills, tend to have poorer outcomes. They're less likely to understand their diagnosis as we give it to them, less likely to come in early and have those screenings and use general preventive care. So of course, they're going to present in the later stages of the disease, which makes it more difficult and frankly, more expensive for us as the healthcare system to manage. They are more likely to be hospitalized, and when they are discharged, they are more likely to not follow those discharge instructions and therefore have to be rehospitalized. So you can see that this is actually a cost issue. One of the studies that was done by Vernon and colleagues at UConn showed that up to a quarter, 238 billion, so more than $250 billion is spent unnecessarily due to limited health literacy. If we pair this or look at this in conjunction with the cost of chronic disease, we spend about $4.1 trillion annually on chronic disease. And this is really, frankly, 86% of all healthcare costs. More than 1 in 2 adults, that's 60%, have at least one chronic healthcare condition. Much of chronic disease is preventable, and most can be managed with health literacy skills. So we start to get a little clearer picture of why health literacy is so important. And this is not only from just the personal perspective in terms of people being able to take care of themselves, but also from this perspective of us moving toward a more equitable and more cost-effective and cost-efficient healthcare system. So again, some tools and tips in terms of how to do our own part in terms of making sure that we are meeting patients where they're at. So if we're in this area or this task of creating effective written communications, we can really ask ourselves 3 questions. Why are we developing the piece? What's the purpose? What do we want to achieve with this? What does the reader need to know? What is the essential information? And what do you want the reader to do? And we'll talk about this in a moment, but one of the biggest mistakes that we tend to make is, frankly, showing off and just doing a brain dump and telling individuals every single thing that we know about a particular disease or condition. And frankly, that doesn't help. What we really need to focus on is what are those very specific need to know or need to do things that the reader needs to understand. All right. So some typical document problems is that as I said, we're providing too much information. Limit those key messages to no more than 3. Our brains have really kind of a limited ability to absorb and retain new information. And especially when we're talking about information in an area such as health education, where we tend to use a lot of jargon and a lot of difficult terms, and these are foreign concepts to people, we really need to make sure that we're just giving these individuals no more than 3 messages. The readability level is much too high. Aim for a 6th grade level or lower. And there are multiple tools online that you can use to check your grade reading level. A lot of times the information we're writing is not interactive. Engage your reader with questions. Create checklists. Tell stories. One of the most effective methods of conveying health information. Use those second-person pronouns, you and your, when possible. People tend to remember things when they feel that they are part of it and they are more engaged with it. And then finally, another problem that we have is using difficult to understand words and jargon. Rather than hypertension, it's high blood pressure. Use simple, what we call living room language. Just use the words that people understand, that we use with one another in everyday conversations. When you're creating your document, let's understand and define who your audience is and what your messages are going to be. Organize your document so that you're giving people information in a way that they can understand it. Use those headers, short, bold, little introductions to what you're going to be talking about. That helps people understand what's coming and for them to understand that information a little better. Involve your end users early on. Focus groups, as we say at the bottom here. Sequence that information logically. People need to understand what their condition is, why it's important, what to do, and then what to look for. There are sequences that we can put our information in that make sense. Write your message in a clear and simple and engaging fashion. And if you're not sure if it's clear, simple, and engaging, that's what your focus groups are for. Make sure you use good design processes. And we can't really get into a ton of those here, but using a lot of white space, using pictures, graphics, making the page look not daunting to read will really get you very far. Test your information, revise it based on those results and what you learned, and test it again. Focus groups are best if you're able to do that. In the terms of the one-on-one communication, again, we talked about this issue of trust, and individuals are much more likely to understand and believe and do the things that we are asking them to do if there's some trust there. So how do we build trust in those one-on-one communication? Greet your customer or patients very warmly, make eye contact, be an active listener, encourage them to tell their story in their own words. We don't need them to adopt our language and our sense of formality. Just listen to what they have to say. Tell me what's going on. Tell me your story. Use plain, non-medical language, again, living room language. Listen very carefully while those individuals are telling you their story. And if they refer to something using a certain term, use that term back with them. Slow down and limit and repeat that content. So just make sure you're giving them time to process this. Be very specific and concrete. I need you to exercise every morning when you get up. Go for a walk for 20 minutes. That's very specific, rather than, try to get some exercise. That's very non-specific. So try to be very specific and concrete. As we said, show graphics, pictures if you're talking about internal organs or where bones are located or why something is going on. Show a picture. Demonstrate how something is done. If you're asking somebody to use some equipment for their asthma, demonstrate how that's done. Ask them to do it. Invite them to participate. Encourage those questions, and then use the teach back process. And that's a whole process, and we'll get to that in just a bit. So what is teach back? Teach back's a way to make sure that you, the provider, have explained information clearly. It is not a test or quiz of what your customer or your patient remembers. Ask them or a family member to explain in their own words what they need to know or do in a caring way. And this is after you've provided your explanation. Teach back is a way to check for understanding, and if needed, re-explain and check again. So if you told your customer or your patient how something is supposed to work, and you ask them to explain back to you in their own words, and something's wrong, guess what? That was your problem. That was your fault. That was not their fault. So understand that there's a break in the communication there, and that's the piece you need to go back and restate in a different way until you are confident that they understand it. This is a research-based health literacy intervention that really promotes adherence, quality, and patient safety. It's what we would call an always event, that we want to stress that we should always be using this. And there's a Teach Back toolkit that we provide on our Health Literacy Solution Center. If you type in teachbacktraining.org, you can get right to that. Design, and so we talked a little bit about design earlier on for written materials or online materials. Make sure the information at least looks easy to read, because if it doesn't look easy, people will just, trust me, time, understanding, they will just pass it by. Leave lots of white space and margins in between paragraph, in the margins and between your paragraphs. Use those headings and subheadings. It prepares the reader for what's coming up, or in terms of their ability to navigate that document. If they need to go back and find something, those headers will allow them to find that quickly, and they won't have to reread the entire piece. Group and chunk like information together. So bulleted or numbered lists. Bring that like information together into groups. People will tend to remember things when they're grouped together rather than if you have it all scattered throughout the document. Your typeface and size, a sans serif type, which is what you're looking at right now. The serif are those little curly cues that you see on letters on the very tips and ends, the little flourishes, those are called serifs. Better for you to be using the sans serif, such as an Arial for headings and web. And then a serif, which we just talked about, like a Times New Roman for body copy. Try to go with at least 12 point and absolutely no all caps. If you've ever looked at something written in all caps, it is so difficult to read. Use boxes or call outs, put those key terms and messages in a little box that people can look at and go, oh, okay. So that's the little key term. If they look at nothing else on the document, what's the one sentence or the one piece of information you want them to walk away with? That's the bit of information you want to put in that box, that call out. And then use explanatory graphics. This tends to increase comprehension and demonstrate while you're doing this. Okay, so here's a very extreme example. Take a look at the page on the left. No margins, no white space, tiny type. People are going to look at this and just say, no. How can we redo that information? There's a header there. There's a graphic talking about how to construct a healthy plate. Half of it's fruits and vegetables, 1/4 lean protein, and 1/4 grains or something, fiber. You can see the spacing in between the lines there. There's space, extra space between each paragraph. We've used that chunking with the bulleting section in the beginning, and we've left plenty of white space. So if somebody looks at this page, they may say, we hope, this is something that I can read. The one on the left is like, no, I don't even think I can read through that. I'm a pretty decent reader. So here's another example of just being way too wordy. So here's information that was taken out of an actual mailer to members of a health plan. This is from the health plan. In order to be responsive to member problems and concerns about the HMO's policies, programs, procedures, personnel, or health benefits and services, the following grievance procedures have been established. So maybe what we were really trying to say is, if you have a problem or complaint, here's what to do. So I understand this is a very simplistic example, but this is very concrete. And just to say, quite often we get in our own way when we're trying to sound very official and important and smart. Just use the plain language, take out all of the extraneous information and just get right down to the heart of what it is you want to communicate. There's a concept called universal precautions, which essentially is saying, let's not try to identify all of the people who have limited health literacy skills and have a different approach to them than we do the others. Let's just make the assumption that everybody prefers to have information communicated to them in a simple, plain, understandable fashion. Because you really can't always tell who may have struggled reading health information. Aim for that 5th or 6th grade reading level for all your customers and patients. Involve your stakeholders in planning, as we talked about earlier. Limit that information to those 3 key messages. What is it that they need to know or need to do? And those, no more than those 3 key messages. When you are having those conversations, ask open-ended questions. Don't try to stay away from the yes and no questions. Ask the questions such as, well, what are some of the things you're concerned about? What is the one thing you're most afraid about with regard to this diagnosis? Tell me how you're feeling right now. What's giving you trouble? Those are open-ended questions, and then you can listen to those responses. And then just develop some good communication aids, those graphics, pictures, anything that will help that information to stick with the with your patient, your client. Really, let's just make a commitment to pay attention to health literacy in everything that we do. There's a lot of different tips and information, lots of different things on the internet. We provide one at our Health Literacy Solutions Center, healthliteracysolutions.org, and we have a lot of links to outside materials and outside websites to help you to provide that information as well. One way for you to embark on your own professional development journey is to expand your own health literacy knowledge. And one way to do that is with our Health Literacy Specialist Certificate. This is an assessment-based certificate program, which means you are given learning content and you need to pass a quiz at the end of each one of those, what we call micro-credentials, in order to earn the micro-credential. This was launched in 2021, developed over 5 years using Institute for Credentialing Excellence 1100 development standards. We employed over 50 subject matter experts to make sure that that content was correct and up to date. And we go through a regular process of updating that material as well. There are 7 standalone, what we call micro-credentials. All 7 of those together comprise the Health Literacy Specialist Certificate. These are online and self-paced courses. The cost, it depends upon which course you're taking. Some are shorter, so those are less expensive. Some are longer, a little bit more expensive. There is the URL for you to go to find out more about that. And here are the certificates themselves. Communication, education, ethics, public health, organizational systems and policies, language, culture and diversity, and community engagement. You can see the number of lessons in there. And if you earn all 7 of those micro-credentials, you will earn the overall Health Literacy Specialist Certificate. I hope this presentation has provided some value to you. If you have any questions, please feel free to reach out to us. Best way to get to us is at the healthliteracysolutions.org. Thank you very much.